Here you can see towards the centre of the diagram the sort of average concentrations of these particulates in a number of developing country cities, including Kolkata, Mumbai and New Delhi, shown there in orange. And all of them you can see are way above the guideline that's recommended for sustaining reasonably low risks to health from the World Health Organization. So this remains a major environmental challenge. Another graph that many of you will recognize, I think, is the one that shows us how the populations at large, average life expectancy is quite closely related to average levels of wealth. And with increasing wealth on the left-hand side, you can see how life expectancy rises fairly fast. There you see the large population of India, which is coming up towards that bend, turning to the right, where the gains tend to flatten out because the major historical problems of infectious disease and malnutrition, childhood deaths have been eliminated once you get far enough along the graph. But of course, that graph may flatten out a little further if we allow our populations, for example, to become increasingly overweight and obese. We may see the return in richer populations and in populations everywhere as they modernize of higher rates of heart disease, diabetes, and certain cancers as a consequence of that. Here are some of the figures on obesity and diabetes, and around the world, these are quite alarming. When you see the total number of overweight and obese persons, currently around almost a sixth of the world population, and likely to increase another 50% within the next decade. The prevalence of type 2 diabetes, a major consequence, huge numbers already, but we're on track on current trajectories for a tripling of that by the year 2030. And you can see in the list at the bottom that India figures quite prominently among those countries with now a very high prevalence rate in type 2 diabetes. So again, these are all things that are reflecting to us things that are wrong, things that are out of kilter in the sorts of physical and social environments and the food systems that we've developed. They're population level issues. Just a little glimpse of how things vary within India. A graph that I came a couple of years ago from a colleague showing how the rates of overweight on the vertical axis vary in relation to the per capita wealth at the state level within India. And that's telling us something about what the rise of affluence, consumerism, sedentary living is doing to the risks of these diseases. Now, I want to pause then and reflect on the evolution of our perspectives in epidemiology as a fundamental research discipline in public health, and think about the changing levels of focus that have applied at different stages of the evolution of epidemiology. And I'm also making the point that it's a discipline that is applied and therefore must always be responding to the changing social agenda, the changing pattern of health problems, which now includes these larger scale environmental issues. If we look over on the left-hand side and think of the history of the rise of epidemiology in Britain, where it is, I think, best documented and the longest history. In the middle of the 19th century, there was a great interest in comparing different cities, rates of death, urban versus rural populations, rich versus poor suburbs. It was that comparison of groups and subpopulations that was giving important information about differentials in health risks. Later that century, we had the rise of the germ theory and new science that gave us insight into micronutrients and how they operated via metabolic disturbance and which specific diseases they disturbed. And this gave us opportunities to think about interventions at an individual level now that we had specific agents that we could bring into our disease prevention strategy. So the focus swung more from populations towards thinking about the care of individuals and families. And During the 20th century in developed countries, and particularly led by the United States, epidemiology became preoccupied with trying to account for differences in risk of disease between individuals as a result of different behaviours and exposures at that individual level. And we became very good at elucidating those relationships, but we tended to lose sight of many of the bigger questions about why are these rates of disease changing in populations over time. More recently, that's come back onto the agenda with the sort of reassertion of the social epidemiological perspective, saying, look, you need to not just know that smoking causes lung cancer, you need to explain why the distribution of smoking is so uneven within populations. What are the social, economic, cultural influences that account for that? And now we have these bigger questions pressing on us about the sustainability of population health, given that we're starting to disturb or weaken some of the Earth's life-supporting systems. Well, here we are. Let's just look at this planet that we live on, and this is the first half of this diagram, and it's showing us the number of planet Earths that we need to meet human demands. It's not easy arithmetic to do. This is rather a heroic graph. A couple of research groups have done this, putting together all of the information on environmental stresses and disruptions in relation to growing human populations. And the best estimate is that during the 1980s, we actually passed that point of balance, and we're now incurring ecological debt as our ecological footprint grows beyond the capacity of the planet to provide in sustainable, indefinite fashion. And that's the number of planet Earths available to us, 1.0, and currently we're up about 1.3 in our level of annual consumption. So we've got to think about the options. Do we go on with business as usual? Or do we embark on a slow or a rapid transition back to what we might think would be sustainable environmental practice? And rationally, the answer is obvious. Politically, it's a big challenge, and that's where we come in again with our expanded repertoire of research interests and methods in public health, trying to provide for the community at large a better understanding of what the risks to human well-being and health are from these changes. Now, this is the hardest slide, so anybody starting to drift off to sleep, you need to wake up and work on this one for a moment. But what it's also emphasising is that climate change doesn't exist on its own. I'm mostly talking about it, but it's part of a syndrome that's reflecting this fact that we are overloading Earth's natural systems, and that's starting to weaken a number of the great processes and systems that we depend on with respect to food production, fresh water cleansing and cycling of other nutrients, the environmental buffering against environmental disasters provided by coastlines and forests and so on, if they are intact. Not reasonable constraints on the activity of infectious disease agents. All of those sorts of things are coming under stress, and if you look around this roadmap, you can see on the left those large changes that were not being talked about 3 or 4 decades ago, but have come onto our agenda with a rush. And at the top, I've stressed that, yes, some of these are readily easy to conceptualize in terms of their direct effects on health, from increased ultraviolet radiation exposure with ozone depletion. Thinking about climate change, the direct effects due to more extreme or frequent heat waves, change in the pattern, the variability of extreme weather events, the consequences, some of the consequences of sea level rise. All of these things can have fairly easily understood direct effects. I think the things that are of greater consequence and worry in the medium to longer term are the ways in which climate change, along with a number of these other stresses, will affect the patterns of infectious diseases, shown there in the bottom section of the diagram, and how these things are going to affect our capacity to produce food. And a number of arrows converge on these two very important boxes, both of them very fundamental, of course, to the health of human populations, and reflecting two of what the Christian Bible refers to as the 4 horsemen of the apocalypse, talking here about famine and pestilence. I won't talk through any of the details of this. I simply wanted you to, again, appreciate that we shouldn't be reductionist in thinking about climate change as something that exists on its own. Very often, what it will do is compound an already environmentally stressed situation that is beginning to erode the supports of population health.